medicines that cause deficiency, because if you understand this, like many of you, the average person in the United States over 40 is on 5 or more medications. And that's, I've had a lot of people tell me they go to their doctor. If they're not on medications, they go to their GP and their doctor says, what do you mean you're not on any medications? There's something wrong with you. Like, that's a crazy, first of all, that's a crazy thought. But that's kind of where we're at today. But what medicines can cause meds that deplete zinc, right? So one of the big ones rather, are blood pressure meds. So if you're taking medicine to lower your blood pressure, if you're taking diuretics, for example, or ACE inhibitors, or angiotensin receptor blockers, ARBs, ARBs, those 3 classes of medications have been shown in study after study to interfere with zinc absorption and zinc function. So if you're on blood pressure medications, monitor your zinc levels, because when you start inhibiting your zinc, the problem with people on blood pressure medications is, again, you're lowering your blood pressure, try to reduce your risk of heart disease, but then you're lowering your zinc level. And so remember why zinc is important. Remember all those functions of zinc that we talked about earlier. It plays a role in structural proteins, plays a role in healing of the gut, plays a role in detoxification, plays a role as an antioxidant. There's so many different things that are wrong with lowering blood pressure and causing zinc deficiency that actually end up increasing the risk for heart disease. And probably zinc's antioxidant function is one of the biggest kind of tail-chasing examples that I can give you. Now, estrogens, if you're taking estrogen-based medications, know that and it doesn't matter whether it's oral, whether it's sublingual, doesn't matter whether it's under the skin type of troche, doesn't matter how you're using it. Whether it's a lotion, whether it's an under the skin pellet, or whether it's an oral medication. And even those of you who have vaginal inserts that are birth control that secrete slowly estrogens over time, estrogens can inhibit zinc. They can, cause zinc deficiency. Number 3, steroids. And there's an irony with the steroids, because steroids are generally used to block inflammation, right? And so why would we want to block inflammation? Most people want to block inflammation because they're either having pain or they're having some type of chemical reaction on their skin, so some kind of major skin inflammation. Remember what we said earlier? So zinc deficiency can cause dermatitis, inflammation of the skin. So let's take a scenario here. So you got dermatitis, right? Let's change colors. You get dermatitis. The doctor says you have skin inflammation, but doesn't say why you have skin inflammation. So then they pump you full of a steroid, right? And over time, that steroid reduces your zinc. And that zinc deficiency leads to dermatitis. Okay? Who's winning in that scenario? No one, right? Especially if the original reason why you have dermatitis is actually a zinc deficiency and not something else. I mean, there are a number of different reasons dermatitis can happen. I mean, infection is a reason. Some people have vitamin A or zinc deficiency, and that creates dermatitis. Some people are being exposed to things that they're allergic to, so they have some type of topical dermatitis. But bottom line is, if you've got inflammation of the skin, you would want to know why. And if you take a steroid, over time you're blocking that zinc. Remember what else steroids block. Steroids also block calcium, they block magnesium, they block vitamin D. So again, we're trying to block that inflammation, but in doing so, we're creating a zinc deficiency. And remember what's important to heal. Zinc. We need zinc to heal. We need zinc to regulate immune function. It's got so many different functions. We don't want to take drugs long term that are going to contribute to its deficiency. A 4th class of medications that can cause zinc deficit are antibiotics. And again, the irony in this one is the antibiotics are designed to kill the infection. Well, zinc adequacy helps your body kill infections through the immune system appropriately. So again, if you're that type of person that has chronic infection repetitively over and over and over again, the type of person I mentioned before, and you go on antibiotics multiple times a year and you're just crushing your zinc and crushing your zinc and crushing your zinc, of course you're going to have recurring infections, because you're suppressing one of the very important, crucial minerals that allows you to fight, that allows you to actually produce the chemicals and upregulate the immune system. Remember, part of zinc's job is to make sure that your white blood cells are adequate and strong enough to do their job. So number 5 on this list, antacid medications. So if you're taking, any of the different acid blocking drugs like Nexium and Protonix or Tagamet or omeprazole. Doesn't matter which one. They all, if you block stomach acid, you're blocking zinc absorption. Zinc requires acid to properly be absorbed. So very, very crucial that you understand that any of these 5 meds taken, and I'm not talking about short-term use, guys. I'm not talking about, you took it for a short period of time, less than a month. I'm talking about the chronic use of these over time is where we start running into the massive deficits and the more major problems associated with it. So again, those are kind of, you look at both sides of this, these are the ways that we can develop a zinc deficiency through choice, through behavior, right? And then these are the ways that we can develop zinc deficiency by trying to treat that choice or that behavior with artificial chemical suppression or artificial chemical manipulation. Remember that no healing occurs as a result of the use of medicines, except for there are a couple of different examples. The biggest example is, I don't want to rag antibiotics too hard because they've saved millions and millions of lives. But if you don't have a bacterial infection, or if the doctor's just prescribing you the antibiotic just in case, like those are bad ideas. You want, anytime you're going to go use an antibiotic, you either need that, your life needs to be threatened by that infection in a big way, or number 2, you need to have had a culture done where you know what kind of bacteria it is and what antibiotic is best served to kill it. Because many of the antibiotics today, especially drugs like Cipro and some of the other more powerful antibiotics, can create a lot of problems associated with zinc deficiency. Remember, some of the symptoms associated with zinc deficiency are easy wound damage. So you could just injure a tendon, injure a ligament, sprain or strain, it never heals. You could bump into the wall and you bruise super easy and it never ever heals. Well, that's because zinc is necessary for the collagen cross linkages. So the collagen to be elastic and strong in your skin and your blood vessels and your tendons and your ligaments, you need zinc to help bind those cross links on collagen to be strong and elastic. And that's one of the reasons why some of the antibiotics trigger, especially, again, I'm picking on Cipro here, but it's a major class of medication. That particular medication is notorious for creating severe tendinopathies, where the tendons take on tons of inflammatory damage, and then a person can end up crippled for several months after the use of one antibiotic. So my point here to say this is, use it if you need to save your life, but use it judiciously, and don't just jump into it. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below, and as always, thanks for tuning in.